what you're going to have is, hey, you want to have sex all the time? Want to have sex all the time? Let's have sex all the time. Have sex all the time. Let's do it. 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 That's adrenal PCOS. It's going to make you feel like you have to go to therapy for your drug addiction, which is sex. And no one's on the radar. No one thinks about that at all as a symptom of a disease. But it is. I know. It's ridiculous. Well, I just want to have sex all the time. And you have a problem?
Not a bad thing.
It's not bad. Go home. Do that.
Adrenal PCOS sounds like it's not too bad.
Yeah, but when your period's all wonky and everything's all wonky and your hormones are all stupid, yeah.
Welcome to Disability. We are your hosts, Will
and Gwen Parks.
Relax. You're with family. Let us entertain you with raw, unfiltered, lively discussions.
Awkward antics with a dash of sass and a pinch of quirk.
Lighthearted awareness, education,
and sometimes a little mischief.
Celebrate life,
love,
and difference. We are Disability.
Hello, everyone, and welcome back to another edition of Disability Podcast. We are looking to close up our current little series here that we are doing on Gwen's health update. Who knows if there'll be more? It feels like your health is always progressing into, especially right now, into something different all the time. So to say this could be like the end or the last episode, who knows? Who knows? But currently right now with the current situation we were discussing, we're going to wrap this up today. So without further ado, we'll just dive right on in. If you've watched the first two episodes, which I hope you have, because if not, some of this or most of it probably ain't going to make any sense as to where we started and where we are now. So we come out of Hopkins at this point. Just a recap from the last episode. You're home now. We went through that whole month-long stay. Now you're back. Okay, so we'll just kind of dive right on in at that point.
Yeah, I'm not stable. The last week I was in Hopkins, they were just expecting me to be discharged any day. So they stopped running lab tests and they stopped checking certain things. But when I left, I did have them, before I left, I had them check some things. And they didn't look that great, but they discharged me anyway. So I went home.
What kind of things?
My electrolytes all out of whack still. God, the craving of sugar, remember that?
Well, you still have, I feel like, yes.
The magnesium was all out of whack. It's like, what are you doing? I don't know, I'm just eating sugar. I just have to put sugar in my mouth. It's like a fiend with the brown sugar because it's healthier, because it has molasses in it, so it has iron. I had to justify my reasonings, I had to make it more healthy.
Yeah, those last few days of you being in there just was kind of like, God, I just wish you could come home, because it was like you said, they weren't really doing.
Was in the NICU, and we were like, I want to steal my baby.
Yeah, it's like they weren't doing anything anymore. They were just doing vitals and coming in every several hours to just check vitals and whatnot, and then just
make sure I wasn't dying from some other random unknown cause.
Yeah. So you came home. I think it was like the middle of October.
Mm-hmm.
Was it somewhere around middle to end of October?
Yeah, so my diagnosis
of 2020.
Leaving Hopkins was failure to thrive in adult. Good luck trying to find any of the information about that, because it's just about infants. Iron deficiency and G-tube placement with the suspected diagnosis of ARFID, which is avoidant restrictive food something intake disorder. I don't have that.
No, and
so yeah.
So you're home now, and we're right at the holiday season, and you're taking a formula that you tolerated to a degree that was enough for you to be okay to to leave, and like, mm-hmm. This is going to be what your nutrition will be. moving forward. We were still in contact now fully with the nutritionist at the VA, because now you're on a G-tube. Now we can talk about the formulas. Now we can see how things are going. But we kind of back to a familiar problem within the VA. We were, prior to that month-long stay at the hospital, we were trying to go see Dr. K, who was the immunologist, who we were going to see for the mast cell, because, what we know is you're degrading at this point, and he can help you. He can prescribe you the meds that will, could significantly improve your condition.
Yeah.
And what was I going to say? Yes. So the good thing is we had the GoFundMe, which we were planning to use to pay for those payments, because we were dealing with so much issues with the VA, just trying to get it in network where we could see him, where the VA would pay for it. So we didn't have any hope for that. So the GoFundMe payments were going to be used to, let's get you to Dr. K for as long as we can, run as many tests as we can, and then we have, money to pay for these appointments.
Well, I get home and I have some back and forth with my PCP, who is telling me that I'm not, I'm not receiving the diagnosis that was given to me in Hopkins of ARFID, and that is the reason that I am now seeking care outside the VA. But the reason I was seeking care outside the VA is because she didn't do a damn thing for all these things. In fact, treating me like a hypochondriac patient. And every time I went in, oh, we'll put this off. Oh, we'll put this off. Oh, you don't need to do that. You don't need to do that. Don't worry about that. Oh, we'll just check that next visit. Like, what the fuck, bitch? What do you mean next visit? I'm here now and I'm complaining now. So she had basically taken what Hopkins said, and if it was a suspected diagnosis, she read all the notes, so it probably said something like patient was not agreeable to the diagnosis of ARFID, which is why it was only suspected in my discharge papers. So yeah, that shit was crazy. So needless to say, I'm trying to get out of the VA, and it takes an enormous amount of time to do so. And in that time, I'm still steadily degrading. Yeah.
Well, yeah, and someone like yourself, who's been within the VA system for almost 20 years, right?
Yeah.
Yeah, so that's the VA system, the VA healthcare system. That's what you've
all I know.
known.
That's
you know what I
it.
mean? Like when you go to doctors, it's through the VA. Everything's through the VA. So you're not familiar at all with outside care, how to go about doing it, or what.
It may sound silly, but yeah, I don't know how to healthcare.
Oh, I don't think. Even people that have healthcare, I don't even think they know healthcare. It doesn't make any sense. So, knowing that we had these hurdles within the VA, and your PCP was not, what's even the word? She wasn't looking. It didn't seem like she was looking for your best interest. She wasn't listening. So once you get to that point where you have a doctor who's not listening to you, who you don't feel like you can trust, it's not good, and you need a different one. So, your PCP is just rendered useless at this point, and she's basically harming your health and your care, because if she's not listening to you and you need this care
completely at this point.
And anyone else that you've talked to has said, like, you don't have ARFID, for example. You even had your psychiatrist do like an evaluation, came back that you did not have ARFID. That was shown to your PCP.
Done at the VA.
Completely disregarded by her. So we've done all we can, and we need to get help. So it's like, okay, let's get you out of the VA healthcare system and get you some specialists on the outside, get you a new PCP, and it can't get much worse. So it's got to get better. So that's what we did. We got you a PCP, and then we started getting funneled into all of these other specialists now, where you were seeing all of those specialists previously within the VA. Now we're seeing all these different, we're getting appointments. Basically, that's the goal. Let's figure out what else is going on, what's wrong. Let's get your health taken care of so we can get you feeling better.
Yeah. So I finally got a PCP appointment after all the back and forth with care in the community, which is another rabbit hole in the VA. When it works great. When it doesn't work, it doesn't work.
And mine doesn't work. It's like a backlog of like weeks and months without an appointment.
Yeah, fun. So I finally get to my PCP appointment and I can't handle it. I just break down crying in the waiting room, and I'm in there with the nurse. She's just weighing me, taking my vitals, and I'm sitting there crying. Um, and I'm just like, I hate this. I hate this like PTSD bullshit from doctors. Um, yeah, so I just sit there and she's like, okay, so let's do what we have to do. Let's get you to see different specialists. I'll put in for all of them. So I left with probably about a good 4 or 5 referrals and tons of lab work. When I say lab work, I mean when I have lab work and you get like one or two vials drawn, they're like, "Oh, look at that! You're normal today." I think the most I've had drawn at one time was like 36.
That's crazy.
Yeah, that was pretty insane. All from like different doctors. We want this, we want this, we want this, we want this. They're like, "Oh, well, let's get rid of the duplicates. There's not really that many duplicates." So yeah, so the first person I saw was the cardiologist. Now this is a good, so the whole ARFID situation was directly after Hopkins, so it was around November 2020. I didn't get to see PCP until the spring
Of 2021.
2021, and I didn't get to see the cardiologist until the summer of 2021. So as soon as I saw him, I was in there for like, no joke, 10 minutes. And he's like, yeah, I think you have dysautonomia. I think we're going to do some testing to rule out some other stuff. So I had to get a whole bunch of different CT scans and other different lab work and stuff like that. And comes back and the next visit, oh, you definitely have dysautonomia. You also, I think you have POTS, and I think you should see the POTS clinic at Hopkins. And that was pretty crazy. So yeah, so cardiology was, it pretty much was a smack in the face, because in 2014 I had asked my PCP, I had gotten worked up for the fainting and all that stuff. And I had asked her about dysautonomia. I said, how can you have hypertension and hypotension in the same body, but without there being a dysautonomic problem? And she's like, you don't have that. Again, another doctor did say I'm hypochondriac. So, you don't have that, whatever. I was like, so I could have been getting help and treatment for this shit for like 7 years. Like, that's crazy. That's crazy. So, yeah, so now I have that. Fast forward a little bit to Halloween, and I'm like trying to go trick or treating with the kids, my role later, and I'm having the hardest time. Luckily, I had my pulse ox on me, and my pulse ox was going crazy, going from lows to highs, and the highs were nuts, like sometimes almost up to 200 beats per minute. And I felt like I was going to pass out and faint and all this type of stuff. And just from walking a very short distance from the car, had testing done for that. And lo and behold, I have something called inappropriate sinus tachycardia, which is another form of dysautonomia. So basically, my autonomic nervous system does not work anywhere. It's fun. No, it's not fun. It's terrible. It's annoying. So stupid.
Yeah, and finding out these diagnoses, whatever, was extremely beneficial to us, obviously for a lot of reasons, but mainly because for years you had been have on and off fainting spells, and you've had all of the symptoms that come along with the dysautonomia and the inappropriate sinus tachycardia, but we never knew what it was. You know what I mean? Completely, like you're fainting.
No,
Why?
I'm just exercising and thinking that, oh, maybe I just exerted myself. Like, I don't know what's going on. My legs feel like noodles. My lips are tingly and I feel cold and I can't really move anymore. So after, like, in the middle of working out, I'm just slumped over like, yeah, just gotta let this pass.
And it's like, what is it? You know
I
what I
don't
mean?
know.
You never know. It's like, what is
I
wrong
go to
with me?
PT and PT's like, I don't know what this is, but it's your regular, so we're just gonna treat it as regular for you. We don't know what this is. I was like, you don't know what this is? They're like, no.
Yeah, so finally finding out this information years later, should have been taken care of in the beginning, was not. But finally getting the information now, we have warning signs. Now we know, okay, this is what she has, and now we know the warning signs of symptoms of what can occur, so we can avoid fainting and avoid things getting worse. So, yeah, that was great to finally find out.
Mm-hmm.
And right around that, this was also you were seeing like the hematologist as well.
Yeah. Hematology. So I went there and they ended up doing a bone marrow biopsy. And apparently that failed so hard they couldn't get the biopsy at all. Apparently my bones are hard. Really sad about it. I could have soft bones. I don't want that. So then he ended up doing it again in office. And he's like on top of the table, like really trying. Like, your bones are really hard. I was like, this is crazy. And I'm like, just go, man, just go. And the whole time I'm sitting there saying to myself, I'm not a bitch. I'm not a bitch. I'm not a bitch. Because it was ridiculous. It was insane. I was numb, so it's not that big of a deal, but it was a lot of pressure, so to speak. The biopsy results come back, and they come back. They couldn't find the mast cells this time, but they found them before. And this time they come up with atypical myeloid cells. I'm like, why? What is that about? We still don't know what that's about. It's just a wait and see type of thing. Like, I don't really know what's there in the bone marrow, but there's something hanging out.
And he was also working like in talks with Dr. K about the whole mast cell situation and things that Dr. K recommended to get done, so that on his end he could also help out with that whole situation too and put more pieces.
Yeah. There was also, well, right now he's dealing with iron deficiency anemia and extreme B12 deficiency.
Currently,
currently,
fast forwarding to right
this
now.
point, fast forward like a lot, like 1 year-ish, and then you get to this, and that's why I look so pale all the time. That's why I sleep constantly. I have a lot of reasons why I do these things, but they've gotten way worse over the last several months, to the point where I am a cat. The cat and I spend lots of time together sleeping during the day. It's beautiful.
It's great to find out that this is the reason for something, because for so long we have dealt with not having answers to anything, and just being left in the dark with your conditions and what's going on. So to go there and find out now that, yeah, your iron deficiency is severely low, like almost as low as it can go. So to now,
no iron stores. I don't know how I move during the day.
To now being able to set up appointments for infusions to get you feeling better, get you some more energy, reduce the fatigue that you feel now due to the anemia and all the sleeping, to just be around with the family more, which is something you and everyone wants.
Yeah.
So really looking forward to that.
I bet you are.
Yeah, definitely. And again, in conjunction with seeing hematology, you're also we're finally trying to get appointments with Dr. K, because right when you got home, we were trying to schedule appointments, but his office didn't want you there yet. They wanted you to rest. And then like we finally were able to set up an appointment, like
I forgot about all
so
this.
delayed. Like it was, I think it was in the summer of 2021 as well. Like around,
Yeah, it was.
we were seeing like a lot of different specialists all around the same time now. And the kid, like,
Yeah.
sidetrack. The kids were troopers, man, because we would all drive and go to take you to an appointment. The kids and I would
Or
kind of
2 or 3 in a day.
yeah, the kids and I would chill in the car. So yeah, I mean, it's hard enough. Like if you're a caregiver and you're driving to all these different appointments like every week, sometimes almost every day of the week, but then you got kids too, and you got to take them with you. So it's tough. But they were troopers. They did
Yeah,
it.
they were.
Yeah, so we finally are able to eventually get you an appointment with Dr. K, and he run a bunch of tests. Now you're able to finally get the medicine he can prescribe
Oh
you
yeah.
as well.
Lovely. Got quite a few more medications as well, and the mast cell component started to calm down and was better managed. And he was like, if you would have gotten here sooner, you wouldn't have needed a feeding tube, and we could have worked on this and other things. And that kind of just it hurt
Yeah.
a little bit. It's like, oh, why'd you have to say I wouldn't have needed a feeding tube? Oh, that sucks. Like I wish I was able to get there sooner.
Mm. Yeah, I mean, so many.
Fucking VA.
Yeah, so many symptoms and requests either got ignored, not taken seriously, too long to get appointments, combination of all kinds of fuckery,
Mm-hmm. During one appointment with Dr. K, and I was explaining some symptoms to him, and I was wondering about the GI symptoms that I was having, and I was like, is this mast cell? Because I've been having this, and I've been attributing it to mast cell, but I'm not sure if it is. He's like, it could be. However, it sounds more like SIBO, small intestinal bacteria overgrowth syndrome. And I was like, what the hell is that? He's like, why don't you go home? Here's some papers. He was like, Google it. Go on YouTube. Watch some videos of some people that have gone through it. And I was like, okay. He's like, I want you to go see a gastroenterologist. If you can get to a neurogastroenterologist, that'd be even better, to see how your overall GI system is working, since it's been quite a while since it's been from Hopkins, and they weren't too thorough. So
yeah, that was another thing. You just get dropped off from Hopkins, and we don't have any future care set up for this feeding tube that's now just been placed in you, and it's like, all right, see ya, boom. It's
no,
like, okay, what do we do about this?
Really, they really dropped the ball on that. I don't care if it was COVID or not. They like, you can't have an in-person appointment. I just had a hospitalization where I had a procedure, and now I have this foreign object in my body, but I can't have an in-person appointment. And then I can't have an in-person. And then when you call me to have this appointment, all you can talk about is my cannabis use. Oh, well, what about cannabis hyperemesis syndrome? Like, I'm really tired of discussing this with you people. Like, y'all doctors need to stop.
Yeah, a phone appointment does no good.
It doesn't do anything.
What for a feeding tube that needs to be looked at.
No.
And talked about.
Maintained.
It does nothing.
Nothing. Like, I should have at least had somebody, like a nurse, come out and look at it or something.
Mm-hmm.
Nothing.
So you tell you're asking Dr. K about the symptoms you're having. Is it related to mast cells? So what kind of symptoms were you having with your gastrointestinal area? What kind of symptoms were you going through that you were trying to wonder if it was mast cell related or not?
My kids call it the wasteland. Your kids are terrible.
It is a wasteland.
It is. Whenever you got SIBO, your bathroom time is a wasteland. It's not 15 minutes. It's like, don't go in there for the next half of the day. It's not worth it. No spray is strong enough. It's just not going to happen. Your body is just rejecting food at this point after it's pretended to make it into some alcohol formation.
It's an unholy environment.
It is.
It's foul.
Tell me more.
It is all things negative. So you have the wasteland. What else?
So I have the wasteland going on. Extreme bloating to the point where I look at least a good 6 months pregnant within 20 minutes of ingesting food, which is ridiculous. Um, it's like, oh look, watch, let me eat this. Watch, you see it? You see it moving? Yeah, ridiculous. So,
and the crazy thing is, these, especially the bloating, like that, is symptoms you have been putting up with for years at this point.
yeah, I'd probably say since 2014, 2015 in earnest.
Mm-hmm.
When we were on the cruise.
Yeah.
Had no idea this man's feeding me things I can't eat. And every time he feeds them to me, I explode.
What man?
You.
Me? I'm feeding you things?
Yeah, you would bring me drinks from the bar in the morning. Like that was so nice of you. It was great. Yeah, a little pineapple beverage.
I know.
But whatever.
But yeah, like, and again, these are symptoms that you brought up when you were within the VA, to your PCP.
And through the GI department. And they were just like, I don't know. Here's some Miralax.
Miralax. Yeah, that was their cure. Here's Miralax every time. It's like, well,
here's Miralax. I'm like, well, there's got to be something else going on if the Miralax doesn't work.
Exactly. So now, so those are the symptoms you have. He recommends you getting the gastroenterologist.
Yep. So I go and finally get to the gastroenterologist. And he's like, yep. Sounds like SIBO. Here's all this stuff about it. We're going to test you. We're also going to test your motility because it sounds like you have motility issues. So that took about a good 4 months-ish. July to...
Yeah. I remember the testing, it didn't get done till like
October,
the fall of 2021.
So, yeah. The waiting. So I had all the tests done, and it turns out I have SIBO. And I don't have a little bit, I have a lot. Now, he treated me for a G-tube infection during that first appointment. So when they got the results back from the aspiration, they noticed that it was huge. Like the amount of bacteria that was in there was excessive to the point where you don't necessarily see that much in people. It's like, that's just because I had it so long. It's like, oh, I thought the antibiotics would at least knock it down if you did have some. You're like, nah. Not even a little bit. Yeah, so it turns out I have SIBO. I have fructose intolerance. I also have fructan and glucose sensitivity. And my bacteria love to eat my B12, which is why I have B12 deficiency. So it makes sense now from the beginning of Hopkins when I'm going and I'm like feeding myself these fruit popsicles. Like, I don't really know, but the popsicles take less time to eat. I mean, they take a long time to eat, so, they're frozen, right? So maybe that's the reason why I'm throwing up. Oh, well, no, it's all the fructose and the glucose and the fructans and all the other stuff and all the food. Slowly poisoning myself with healthy food.
Mm-hmm.
And, yeah.
So, yeah, and so now the big reveal. You find out you have SIBO, which is causing a lot of the symptoms that you're dealing with, and a big part of the reason why you've been vomiting, why you can't keep things down, big part of the reason why your health declined to a point where you needed the feeding tube. And rewinding, as if we haven't talked about it enough, Johns Hopkins. Yeah. The whole GI team at Hopkins. Not one person, not one thought to test for SIBO. But
SIBO is common, though, so that's really why we have a problem.
But the moment we go out to see a specialist, the first thing they suggest is this. They do the test, and lo and behold, SIBO. So why the hell not one person at Hopkins? They couldn't figure it out, but it must be ARFID, right? It must be an eating disorder.
They did an endoscopy, so they should have just pulled the aspirate then, like the GI specialist did, because that's what you should do during an endoscopy when you don't know what's going on. Yeah.
Yeah, that's the frustrating part. Not one person on that GI team, at least to our knowledge, brought it up or even said you never got tested for SIBO. Why not? Why not? You know what I mean?
Yeah.
Why not? When they see your symptoms, they know what's going on. If they fucking listen, they could understand. So why not? It should have been already done then. Nope.
Yeah.
Nope. But you must have ARFID, or it must be related to cannabis because they didn't run the right tests. So yeah, finding that out was just like, wow. Well, at least I'm glad that we have these answers, but now just like fuck all the other idiots that got us to this point. You know what I mean? Or couldn't,
Basically.
or just didn't do it. You know what I mean?
Yeah.
So, and imagine like if we had went and started seeking treatment for ARFID and all these other things, and you know what I mean? Seeking treatment for something that you don't have, and all the while your condition continues to worsen.
I would have died inpatient at the psych facility.
Fucking ridiculous.
They'd be like, we don't know what's wrong with her. You don't need a feeding tube. You just need your eating disorder fixed.
Yeah, apparently that's the core problem there.
Yeah.
Yeah, so glad that we found that out finally. And
well, now I go through all the motility testing. Turns out that I have to go to poop school because I forgot how to poop. Not really, but that's just what I call it.
Yeah, you need a little refresher course on going to the bathroom.
Mm-hmm. And because when you haven't really gone properly for like 3 years, you just don't go properly anymore. What else? Yeah, my intestines don't work. They don't move.
So yeah, so all the while throughout this whole process, we're in touch with nutrition and we're trialing different formulas to see which one, if we can find one that's just going to be perfect. So that's going on as well throughout this whole thing too.
Mm-hmm.
Also, while just dealing with the fact that shortages in bags, and some bags we would get that had like the flush of water, which when you're sleeping overnight, it's good to flush with water to give you some hydration. And then sometimes we wouldn't get those bags. And then for months, I was waking up in the middle of the night every 4 hours to flush you with water. And that whole fiasco was a nightmare. But yeah, so that was a journey in itself anyway. Side tangent. But back to what you were saying.
How you feel about them bags, bro?
A lot.
Lots of feelings. I forgot about that. Fast forward now. Come with me to the closest time ever. It's May of 2022. I'm hospitalized again because I have severe abdominal pain. Now, we think it's appendicitis because I had appendicitis like a month earlier, and we're like, oh my God, I think my appendix is going to explode. Not sure what's going on, so let's get to the hospital. But this is after Will has pleaded with me to go to the hospital for probably a good 2 hours. I don't listen. I'm always like, no, I'm fine. Let me just take some more cannabis. Let me take some this. Let me get some water. Let me do these massages. And Will's like, just get to the hospital. Let's go. Let me know when you're ready to go. I'm ready to go. So we go. Case in point, never knew I was that complex of a patient until that hospital visit. They're like, oh my God, you may need what did he say it was?
Kind of like a
multi-organ transplant. You may be a candidate for that and all types of stuff. And so I come out of that hospital stay with gastroparesis and an ileus caused by dysautonomia. Holy shit! Yeah, dysautonomia if you don't get it treated, it can kill a lot of stuff off. It's your nervous system. It's not fun. So needless to say, that is a lot to process. And yeah, because I had asked in Hopkins during the gastric emptying test. It was delayed in the beginning, but then caught up at the end. And I was like, what is that? That's not normal. Like, oh, it's okay because it finished and it's fine. And I'm like, yeah, but what is that? Because that's not normal. And by the way, did you check my small bowels? No, we're not going to do that. Did you check my intestines, the little rope-like things in there you can play jump rope with for like across a football field, that thing. No, no, they didn't test it because they thought I was, all of that.
Mm-hmm.
I'm a little salty, to say the least. Um, so yeah, so it's official that my insides don't work from the top to the bottom now, and not really sure if that'll ever come back at all because it's caused by dysautonomia, which doesn't really go away ever. So,
Yeah, finding out that, again, putting more pieces to the puzzle, finding out more information, the gastroparesis, causing a complete delay in your emptying. You know what I mean? Like feeling full all the time
yeah,
because things are so slow to move through, and all the GERD that came with it. And that was, yeah. And like you said, like they're running these tests, and first off, when you got to take that gastric emptying test, you got to drink all that liquid, which for you is already an issue. You're in a
that
feeding
was
tube for a
terrible.
reason.
I was like, I was really hopeful. I was like, okay, so I'm hopeful since I haven't eaten anything and they've sucked all the crap out of my body that I can do this test. And they're like, all right, you can do this test. I'm like, yeah, I could do this test. I can do it. I'm like psyching myself up, like I really do this test. And they give it to me and I'm like, all right. They're like, it doesn't taste good. And I'm like, I haven't really had anything to eat in God knows how long. So I'm probably going to be like, this tastes great. Lo and behold, the nasty cherry flavor they give you at the hospital for everything tastes great when you haven't had anything to eat at all. So it took a long time for me to finish the liquid, and it took 5 minutes for me to start throwing it up. I was like, I'm gonna do it. I was like, just give me a bag, just in case. Just give me a bag. I was like, I'm gonna sit here. I'm not gonna do it. I'm not gonna throw up all of it. But it was just enough to finish the test that went through. Just enough. So I can ingest just enough.
Yeah, there was a small amount that was left that they were able to complete the procedure with. But again, it's like, and then the doctors eventually come back and they're like, yeah, there was some, it was kind of slow in the beginning, but then it did go through. But it's like, okay, let's focus on that because let's look at what happened, because for one, you weren't able to finish the liquid.
Mm-hmm.
Almost all of it came back up because there was no room and it wasn't going to make it through. So it comes up. And then the fact that there was such a small amount left, and even that in the beginning took a long time to get through, that needs to be highlighted. You know what I mean? Yeah, it made it through. I understand that, but look at what happened in the very beginning. Like, are we just gonna like act like none of that happened? And like, you know what I mean? Like, because it seemed like they were just focusing on the end result, but it's like, okay, what about the whole process here? Because clearly there's major slowing here. Like, it's not going anywhere. Yeah.
Pulmonology. So I've seen them for. At that point, I don't know what I'm seeing them for. I have an inhaler. I know I use it. An albuterol inhaler, and I had gotten that prescribed after eating shellfish and getting bronchitis at the same time. So I had an inhaler for the last several years because I had bronchitis once. Go VA. But I would ask them about it, and I did a pulmonary function test. Oh, your lungs are fine. I'm like, okay, that's great. So no asthma, no nothing. So I'm talking to my PCP. One of the things she said is, oh, well, why don't you go to the pulmonology lab at GBMC? I'm like, okay, I'll go do that. Set up an appointment and get all the testing done. And he's like, you have eosinophilic asthma. I was like, what the hell is that? Basically, your eosinophils are high. So then you have asthma. That's it.
And how long have you been dealing with that? That just went undiagnosed within the VA.
I've been dealing with that since, I believe, at least 2018.
Okay.
At least.
And again, just to backtrack, 'cause you may have said this, but I may have glazed over it. You brought stuff up like that in the VA, and what was there?
That since the pulmonary function test was fine, that I was fine.
Okay.
Here, I can't breathe. I'm like, well, I'll just use this inhaler. Use your inhaler when you need to. Like, okay. I'm like, but people that don't have lung problems need inhalers? Please help.
Yeah. Okay, so you find that out with the pulmonologist.
Yeah, so that's another thing to worry about.
And it was around this time also where we start seeing a holistic doctor. What do you?
Functional medicine.
Functional medicine. I always mess up the in my brain.
Because
no
it's
matter what.
naturopathic. You have
there's like multiple ways to say things.
No, they're completely different doctors.
My brain
they do
says
different things.
It's the same.
I know.
I'm a special guy.
It's not specialness. It's healthcare. We don't healthcare.
That's true.
You don't healthcare.
Not much. Just with you.
I've had enough.
I'm the tag along to your healthcare.
Wow. Don't die by something stupid.
I'm not. When I'm sick and I need to go, I go to the doctor.
Okay.
I ain't one of them people that ain't gonna go to the doctor for when I'm sick. And you know that. Anyway. So yeah, you're seeing her. She's running. Well, this was also recommended by the nutritionist.
And that's why I went to go see them.
And you had also thought about it before too. Like this could benefit me. Just to get another look at things from a different view.
Yeah. So functional medicine did a bunch of tests, came back with all these things. We've got, I'm just going to read them. So functional medicine came back with hypothyroidism, reactive Epstein-Barr virus. I don't even remember having the virus to begin with, but apparently it's just hanging out there running amok and causing fuckery. Adrenal PCOS, which literally it's makes so much sense now. Leaky gut, low testosterone, and systemic candida. So adrenal PCOS is one of those things that you don't really know is going on until it gets bad enough for it to show in testing or whatever. It's just like you just don't realize that it's going on like at all, because it doesn't have the same type of symptoms as PCOS, polycystic ovarian syndrome, has normally. It's a completely different type. What you're gonna have is, hey, you want to have sex all the time? Want to have sex all the time? Let's have sex all the time. Have sex all the time. Let's do it. 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 That's adrenal PCOS. It's going to make you feel like you have to go to therapy for your drug addiction, which is sex. And no one's on the no one thinks about that at all as a symptom of a disease. But it is. I know. It's ridiculous. Well, I just want to have sex all the time. And you have a problem?
Not a bad thing.
It's not bad. Go home. Do that.
Adrenal PCOS sounds like it's not too bad.
Yeah, but when your period's all wonky and everything's all wonky and your hormones are all stupid. Yeah.
Yeah.
So she backed up a lot of the stuff that I had been dealing with, especially with the leaky gut from all what's going on in there, and the candida, because that's crazy. It's not in my gut, but it's like everywhere else you can find it. It hangs out. I don't really know. But without functional medicine, I don't know where I would be right now.
Yeah, she was great.
So winding down here, we've got urology. Urology is where a lot of my pain was getting answered. So I had some severe right-sided pain, and no one could tell me what it was. And I'm like, I guarantee you it's my liver. I swear to God. Somebody tell me it's my liver. I know it is. They're like, it's not your liver. It's my liver. No, it's not my liver. It's my kidney. So I have right kidney angiomyolipoma, which is a fat tumor basically. Just hanging out in my kidney, causing issues, causing pain sometimes. And it just grows. If it needs to be cut out in the future, it'll get cut out. But that's a watch and wait type thing.
Yeah, that wasn't it. I thought it was kind of like decreasing in size.
Oh yeah, cannabis.
So it is decreasing in size.
Yeah, it's
right?
decreasing in size. However, if for whatever reason it starts growing again, they can just cut it out. Mm-hmm. And the last one, dermatology. So I've been dealing with dermatological problems since I was in the Navy, and everyone's done all this different type of stuff. I went to dermatologist one time, first visit. I get diagnosed with hidradenitis suppurativa, which is like a skin condition. Well, that makes sense. Dermatologist, duh.
some sort of skin condition.
Some sort of skin condition. And then this last appointment, I get diagnosed with dyshidrotic eczema. Now, a lot of these things I have diagnosed myself with way before I've seen any doctor. And it's really annoying when you know your body and you know a little bit about the body. It's not like I didn't go to school for these things. And when you know that type of stuff and you can pinpoint that type of stuff and you're like, okay, I know it's this, but your labs don't show anything yet. You just look crazy. You look crazy all the time. So I'm like, all right, so I'm just going to keep telling you I have this same pain. And at some point, it'll show up in the labs. Some point.
Yeah.
In imaging or something. If you know your body, you know your body. Doctors, listen, we know our bodies. You only see us for like 15, 20 minutes once every 3 to 6 months. Some of us once every 12 months. Specialists.
I know.
So, all in all, after leaving Hopkins, after getting mostly out of the VA, I have been diagnosed with 22 new conditions that we have just went over. Needless to say, adjusting is difficult, if not impossible, because I'm just sitting here waiting for more things to come out of lab work or more things to come out of imaging. What's next? It's really hard to focus on anything or process anything really, just because it's so many.
Yeah.
So much.
So circling back, that is caught us up to this point now where we are in winter of 2022.
Winter?
We're like a couple weeks away. Okay,
Bro, it's fall.
It's December.
It's fall.
Okay. It's less than 2 weeks away from
It's
winter.
fall.
Whatever. It's December 2022.
Fall.
And that's where we are now. From the beginning of the process to now, we've learned a heck of a lot. But, I mean, look how long it's taken. Like, from the beginning of when you got the feeding tube, all the questions now, most of them have been answered 2 years later. Here we are, finally figuring this whole thing out. So we can know how to treat you moving forward and what to do.
You better treat me right.
Always, baby. So yeah, thank you all for coming with us and listening to this just craziness.
Tome. It's a tome.
Yeah, and seriously, anybody who is going through similar shit with doctors, misdiagnoses, whatever it may be, like at the end of the day, just listen to yourself. Like you have to, you got to stand up for yourself and you have to fight for yourself, because a lot of the times no one else is going to. And if you know, if a doctor's putting a diagnosis on you, and you know, like deep down, you know your body more than anyone. If that just isn't what it is, then fight for yourself. You know, see someone different. It's not the end. Um, yeah, fight, man. You have to fight.
It's hard, but you got to do it.